I'm Nate Eaton, and today we have in our studio Governor Brad Little, also the Director of Health and Welfare for the state, Dave Jeppesen. We are trying to sit as far enough from each other as we can because we are talking about the coronavirus today. Thank you both for coming in here. Governor, what kind of update can you give us today as far as what's happening in the state with the spread of COVID-19?
Well, last night at 5, we had a press conference. We announced that in Blaine County in the Sun Valley, Ketchum-Haley area, we had limited community spread. We had community spread, and consistent with our message all along, the director's issuing an isolation order today for people to stay home, stay in, ramp up social distancing, do everything we can to stop the spread in Blaine County.
Are you predicting anything like that happening in eastern Idaho? I guess
we're a long way from that.
Okay.
But things are moving very fast. Things are changing very fast, globally, nationally. Obviously, in the state of Washington, it's changing very fast. So we're being adaptive. We adopted the Center for Disease Control standards, and that's the state-of-the-art science, and Dave and his crew, the public health districts here, are the lead, and then Dave is the overarching administrator from the state.
Dave, let's talk a little bit about the tests. It seemed like the numbers were small and gradually trickling in over the past few days. Are we expecting a major boom here once all these tests come back?
That's a great question, Nate. We actually have seen, obviously, specifically in Blaine County, an increase in positive cases that have come back. We know that community spread has started there, and so we actually are expecting to see more cases in Blaine County, which is why we've issued the isolation order there. Around the rest of the state, though, I want to emphasize that we are not seeing community spread, at least not at this point. I do want to emphasize that the situation could change hourly or daily, and as it does, we'll update and communicate with communities, and we're on top of that and know what to do. But the current kind of massive increase is really around Blaine County, and massive is up to 16. It's still an isolated transmission there, and we expect those numbers to go up. I do want to emphasize on that isolation order, citizens are still free to go do essential services. So the grocery stores are going to be open. They can still go to grocery stores. The healthcare system is still operating. Utilities, water, power, sewer, all those things are still operating. So we're encouraging the citizens to stay home because that's the best tool we have to make sure that the virus does not continue to spread and spread too quickly. But they are free to go get groceries and those sorts of things.
There's a lot of people that have been staying home this week, and a lot of moms that are going a little stir crazy with the kids. And I know we can't really answer this question that I know of today. How long are we looking at? Are we going to be still in this situation in May and in June?
That's a great question. We're currently doing our modeling at the state level to get a feel for that. And as per the governor's request and our request from the public health side, we really want to spread this curve out. We want to make sure that we don't overwhelm the healthcare system. And what that means is this will probably be around for a while. If we look at what's happened elsewhere in the world, this isn't something that just goes away in a week or two. We do have the guidance and from CDC over the next 15 days to keep groups down to 10 or less to try to slow the spread down. But we shouldn't interpret that to mean that at the end of 15 days, this is all going to be done and gone away with. I think we're in here for the long haul.
Governor, I was speaking with somebody yesterday who said the virus is scary, but to them, they're more nervous about the economy, the economic impacts of all of this. What do you foresee this doing to Idaho, especially small businesses, restaurants, bars, things like that?
Well, obviously our number one priority is the safety of Idahoans, but that's also the safety as far as security, your food security, your security of your home. That's very important. I talked to Senator Risch and Senator Crapo's staff yesterday. There's going to be a big federal program that's going to be here, and we as governors have said we're more than willing to help administer it. There's some things we're doing on licensing. There's some things we're doing on taxes. There were some things we're doing. But if you had a job a week ago and you don't have a job today, that's a crisis. That's something we want to address. We've talked to utilities about what they do about their understanding and their compassion for people that can't pay their power bill or pay any of their utilities. we're trying to address all of those different things. We're reaching out to, there's no central repository for people that are landlords, but we're trying to reach out to them through the realtors about what they do about evictions when people don't have a paycheck. But the federal government, there's going to be, we don't know exactly what it's going to look like, but there is going to be some cash. We are really changing what we do for unemployment, people that qualify for unemployment. We've remodeled the Department of Employment for that, and we know they're going to have a huge surge of people applying for unemployment. We went from 2 weeks ago with the least unemployment of almost any state in the union, and some of our counties with hardly any unemployment, to this in such a real short period of time. So we're being as adaptive as possible. We're fortunate that over years we've gone to an online model for applying for these. Director Jeppesen, what he does on the SNAP program and the WIC program is we're trying to make it to where we can get those benefits to people as fast as possible. I know that the Department of Health and Welfare, when all the states are ranked as far as efficiency of delivering these services, we're one of the most efficient there is in the United States. But that still doesn't help that person that had a job a week ago and doesn't have a job today.
Do we know the long-term impact of schools? Are kids going to be going to school in June and July to make up for all of this time?
Well, we may extend. We did it 4 years ago. We had Snowmageddon. We did extend the school year. I've got a task force working with superintendents from all over the state today, talking about what we need to do. In an ideal world, and some schools did this, they saw this coming. Instead of shutting school off the next day, they waited a day or two to where teachers and administrators could work with kids, could work with families. You know, people could arrange for daycare for their kids. Because literally, you know, a week ago, kids left school on Friday, and Monday there was no school, and it was really an issue. I gave the school districts the flexibility, but I also wanted them to make provisions for these kids to have, you know, programs for kids that, from a nutrition standpoint, but also to continue their education, continue it at home, have ways to reach out for them. We don't know what day kids will go back to school. We're hoping this school year, but we're going to continue to monitor that on a day-by-day basis.
I think everybody is agreeing with you that this all happened so fast. I mean, 2 weeks ago we were kind of talking about this, and here we are sitting feet apart in the studio. Can we check out this
Yes.
chart that you guys brought in? Dave, if you want to explain kind
I'll
of...
hold it, Dave can-
Oh, great, yes.
Okay.
I think we've all seen the curve chart. What is this, though?
This is the curve of how the virus could spread. And there's two important concepts on here. The first is the red flat line there, and that actually represents our healthcare capacity. And the goal here is that we don't want to exceed our healthcare capacity. Simply said, if everybody gets sick at once, that's going to overwhelm our healthcare capacity, and we don't want to do that. So we're doing two things. One is we're working on raising that red line, increasing healthcare capacity, and with the governor's executive order around declaring a state of emergency, that loosened up licensing requirements. It waived many federal requirements to allow the hospitals and the healthcare providers to be much more flexible to raise capacity in the system. And then the second is what we're talking about as we sit here 6 feet apart, is we want to slow the spread down so that when we do get to that peak, it is at or near our healthcare capacity. And so that's why it's so critical that people practice good hygiene, wash your hands, cover your coughs and sneezes, and then particularly to practice social distancing. So if you're out in public, we know that this is a waterborne virus at a minimum. Sneezes and coughs tend to go about 6 feet. That's why we ask for people to be 6 feet apart so you don't get affected by that or affected by that. And then if you do have symptoms, if you have cold symptoms, cough, fever, those respiratory things going on, please stay home, to self-isolate. We don't want to spread this to your neighbors. You don't want to spread this to your coworkers. And the main reason is we want to flatten that curve out so we can make sure we have enough health care for everybody as this peak happens.
I think this relative everybody's reading about Italy. This is Italy. And what happened was they got into this part of the curve before they started doing what was necessary. And so there's all these stories about people in Italy that just don't, there's no capacity in the, some of the, and we hope, Idaho, and we're working every day to do this, we hope we're in this model, or, and ideally this line would be up here and everybody would be covered.
Yeah.
So all the things we're doing are about moving this down and moving it to this model and moving that up. So that's what Dave and I have been doing every day.
And this is something, as you mentioned, everybody watching can do by just staying at home.
Yep. Good hand hygiene and self-isolate if you feel sick, and social distancing.
Yeah. All right, the state has a website that you have launched with all of this information. We will link to that down below. You can go on and check it out. And we appreciate you coming to Eastern Idaho and filling people in. And of course, there's questions. There's all sorts of information out there. Go to the reliable sources, though, if you want answers to those questions. Governor, thank you very much. Thank you, Dave, for coming in here. Thank you for watching.